Hi, and welcome to this special interview with the Canadian Donation and Transplantation Research Program, the CDTRP. My name is Stephanie, and I'm the CDTRP Communications Manager. It is my pleasure to meet today with Maria Morais as part of the National Nursing Week, which is held from May 8 to 13. Maria is a registered nurse with 31-year experience and is also a recent liver transplant recipient. She joined the CDTRP Patient, Family, and Donor Partnership Platform this past winter and is volunteering on the UHN Center for Living Organ Donation Patient Partner Advisory Council. Welcome, Maria. Thank you for taking the time to speak with me today. Can you start us off with some personal background and tell us how you got interested in nursing and what made you decide to pursue it as a career?
Thank you, Stephanie. And it's great to have this opportunity to speak about nursing and how much it's influenced my life in such a holistic way. So a little bit about me. I'm 53 years old. I was actually born in Portugal and raised in Brampton, Ontario. I've been married for about 18 years and have a wonderful 14-year-old son. I went into nursing knowing that I wanted to help others. My understanding of the scope of nursing at the time was pretty narrow, not having any role models in my life. And I really believed that nursing primarily worked, and nurses primarily worked in hospitals and didn't have much professional autonomy, reporting to doctors. I received my Bachelor of Science in Nursing degree from the University of Toronto way back in 1992. And I've been really fortunate to learn and experience so many dynamic roles that nurses can take on beyond direct care, such as leadership roles, research, policy, and advocacy. I've really had a rewarding career with primarily being in the field of public health as a supervisor in the area of chronic disease prevention and healthy lifestyles promotion within several settings, actually. So some of those examples in my practice include way back mom and baby wellness home visits, some school and workplace health programming, research and evidence reviews, which is really important to the field of nursing. And I've also done some municipal policy influencing, mentoring different disciplines and of staff and students, as well as, of course, promoting and protecting community wellness. And we know that through some of the emergency response activities such as measles outbreaks, SARS, H1N1, and of course, the recent COVID-19 pandemic.
Thank you, Maria. What do you find to be the most rewarding aspect of your job as a nurse?
That's a really good question, Stephanie. I think for me, nursing has certainly evolved as a career, and it's not just been a job for me for over the last 30 plus years. It's hard to believe 30 years. So as a supervisor, I get to participate in professional development of others and particularly in new young staff and students that come into the organization, and really influencing their career paths through learning and project assignments. I really love seeing those that I've mentored flourish and be promoted to wonderful opportunities. That really makes me so proud. I've also been able to collaborate with others in and out of the field of nursing, taking on a multidisciplinary and multi-sectoral approach to participate in some really neat projects, such as creating supportive workplace environments that have facilitated mental health, which is really, really important these days, and physical activity opportunities and This involved developing some outdoor spaces with trails and equipment for movement during the workday and during breaks. Also brought walk stations into the actual workplace for workday use. And while people are, doing their emails or on webinars, that kind of thing, and encouraging stair usage rather than elevators to support employee wellness. We also facilitated bringing together local school boards to deal with the issue of obesity prevention for school-aged children, and supporting that through healthy eating and physical activity provincial policies and initiatives. And lastly, influencing municipal partners to get behind the growing issue of diabetes from a municipal planning and built environment perspective. And these are just to name a few examples of my rewarding moments in my nursing career.
Wow, what a career. 30 plus year, huh?
Yes, it's a long, long time. It feels very short, but the numbers, the numbers are there.
So I mentioned previously that you had a liver transplantation in August 2021 from a living donor. How has your nursing practice changed since your transplantation?
That's a super question. Well, for me, it's made me very keen and passionate about learning more regarding my autoimmune disease, and this disease is called primary biliary cholangitis, PBC for short. It's a mouthful. And learning more about the scientific and the magical world of transplant. It's super fascinating, and getting to know some of the key experts in that area, because I was very new to transplant and that whole very specific world, and as well as how I can now use my nursing skills and personal experience as a patient to help others in their own journey. It's made me humble. And even more compassionate and in tune with how a patient's experience can be influenced during their care and recovery. I have taken certainly a positive side in my journey and used my networking and communication skills to build new connections with relevant organizations such as yours, so the CDTRP program, and different associations such as the Canadian PBC Society, and really look at joining forces and increase awareness of liver health, PBC disease, and living organ donation and transplant. During, I think, a time in my life when I was compromised and healing, for the past couple of years, I felt my professional brain kind of shrink and fall behind. And after a career of constant learning and change, this led me to start to engage with people that could help me, and in turn I could help them. So I feel that my credibility as a nurse and having lived experience with a successful living liver donation and transplant supported and will continue to support my ability to get involved and start to give back, as I feel so blessed to be given such a beautiful gift of life and a second chance.
So after your transplantation, you started volunteering at the UHN Center for Living Organ Donation in Toronto by sitting on the Patient Partner Advisory Council. Why do you think it's important to have patient partner voices and patient partners' implication into research?
That's an interesting question because, being a patient partner has been sort of a new thing for me during my post-transplant phase. And it's been a great experience, actually. I never really thought that I would get involved in this manner. I thought very inwardly about me and my own health and recovery. But now, you know, uh, a year post recovery, I started to feel that, you know, this role is important, and it's not new to me, but I'm usually on the other end as a nurse trying to get input and feedback from others through things like surveys to improve, our programs and services. So I was first introduced to a formal patient partner role last year when I connected with the UHN Center for Living Organ Donation program out of Toronto General Hospital to help me celebrate my 1-year liverversary, as they call it, and a fundraiser that I was doing to give back. They came out to my event, they filmed it, and then they used it to increase awareness of living organ donation during the promotion week in September of 2022, which was really, really neat. And I then joined their committee to provide my lived experience, make suggestions for improvement of the donation and transplant journey. And it's been a great opportunity to keep my mind busy while I recovered. And knowing that I had a lot to offer as a nurse, it also helped me to feel useful during my recovery period. The council meets monthly and they have various folks that are represented where we help to provide input to and participate on the committees and the center's strategies and initiatives, such as some campaigns that are out there, social media stories, webinars, and being a peer to others seeking living organ donation and information. So I know that researchers are always looking for patient experience. And sometimes it's challenging as patients may have health issues and other complications to prevent them from being part of studies. But I've been really lucky to participate in a few research studies recently. And one of them actually was through the London Health Sciences Centre related to the prevention of end-stage kidney disease, which I have also developed kidney disease through my autoimmune issues that I'm having. So that's been really neat. And another one that is about to begin, actually, and I'm pretty excited about this one, is with the University of Alberta as a post-transplant patient with PBC. That one will be great to see how I personally benefit from the interventions of both body and mind activities as part of this study. And in particular, my mental wellness. I'm pretty excited about that to maintain healthy in that realm, as it's really important. So I think, to wrap that up, being a nurse and patient partner in research excites me. And it excites me because it means that I get to contribute to important conversations and dialogue to help shape future directions that will impact other patients, and hopefully in a very positive way. And I feel passionate and committed to giving back at this point in my career and journey.
So inspiring. Thank you, Maria. It's nice to see how your lived experience can fit with your professional career. So this is good. Like you get to see the two sides of the medal.
Yeah.
Any final words before we go?
Right. Well, Stephanie, I really want to thank you so much for this opportunity to speak today. I know that our nurses are our future, as it's this year's Nursing Week theme. I understand it to be. And I'm so grateful to never have looked back when I went into nursing, actually, and have had an amazing career and opportunities to experience such varied roles in the world of nursing, you know, being a leader, a collaborator, helping to navigate services and programs, policy influencing, advocacy, and so many more. Um, you know, nurses are so versatile. And now blending my patient partner role with my nursing role will certainly bring me a new perspective to practice. And, you know, again, I really want to thank you. And of course, happy Nurses Week.
Yay. Thank you so much, Maria, for your precious time.
Thank you.
Please make sure to subscribe to our YouTube channel to not miss any special feature like this one. You can also visit our website at cdtrp.ca to learn more on the Canadian Donation and Transplantation Research Program. Thank you.